Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about acyanotic congenital heart disease. Acyanotic congenital heart disease refers to a group of structural defects in the heart that develop before or at birth, yet after birth do not typically cause cyanosis. Common types of acyanotic congenital heart disease include ventricular septal defect, VSD. This is an opening in the wall separating the two lower chambers of the heart called ventricles, allowing oxygen-rich blood to recirculate back into the lungs instead of being pumped to the rest of the body. There are four main types of VSDs, and they are membranous VSD, the most common, located between the tricuspid and aortic valves. Muscular VSD, located in the muscular part of the septum surrounded by muscle tissue. Inlet VSD, located near the inlet of the heart, between the mitral and tricuspid valves, often associated with other heart defects. And outlet VSD, located near the outlet of the heart, between the aortic and pulmonary valves. The next acyanotic congenital heart disease is known as an atrial septal defect ASD, which is an opening in the wall separating the two upper chambers of the heart called atria. This opening increases the amount of blood going through the lungs. The bigger the ASD knot, the more likely it is to cause symptoms and need treatment. There are four main types of atrial septal defects, including the most common type known as secundum ASD, located in the middle of the atrial septum. Primum ASD, located in the lower part of the atrial septum. Babies with this type may also have defects in their ventricular septum, tricuspid valve or mitral valve. Sinus venosus ASD, located in the upper or lower back part of the atrial septum. This type is linked with defects in the right pulmonary vein or superior or inferior vena cava. And unroofed coronary sinus, which is the rarest type of ASD. It involves a missing or incomplete wall between your coronary sinus and the left atrium. It's more often linked with other complex congenital heart diseases. Keep in mind, an atrial septal defect isn't the same thing as a patent foramen oval. The final acyanotic congenital heart disease is called a patent ductus arteriosus PDA, which temporary blood vessel that is designed to be open in the fetus and should normally close within hours a few days after birth. Yet, when this vessel remains open after birth, it allows blood to flow from the aorta to the pulmonary artery back to the lungs. Depending on the size of this blood vessel, the baby's heart and lungs may have to work harder to pump blood. Causes of acyanotic congenital heart disease include a variety of factors, from genetic mutations, maternal infections during pregnancy, and exposure to certain drugs or toxins during pregnancy. Some babies with acyanotic congenital heart disease may not have any symptoms. However, some may experience shortness of breath, fatigue, easy tiring during feeding or physical activity, frequent respiratory infections, and failure to thrive. Acyanotic congenital heart disease is typically diagnosed based on a physical exam, medical history, and imaging tests, such as chest x-ray, EKG, and echocardiogram. Treatment for acyanotic congenital heart disease depends on the specific type and severity of the defect. For example, some acyanotic defects may resolve on their own. VSDs and ASDs may need to be closed with a device or surgery, where a PDA may need to be closed with a medication or device. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.